Hi, I am Dr. Sanjay Bhatt. You are watching me on webindia123.com. Urology is the practice of diseases of the urinary tract. It includes two kidneys which basically produce urine. They filter the blood and put out all the waste products in the urine, and the urine comes down from the two kidneys through two small tubes called the ureters, and it gets stored in the urinary bladder. And then when the patient or the person feels the bladder is full, it is passed out through the urinary passage. So all these are parts of the urinary tract, but we also include two glands called the adrenal glands, which are just above the kidneys and are very important for hormone productions, producing various important hormones in the body. And we also include the genitalia. So this is what all diseases of these various organs is the specialty of urology. In general, different diseases are common in different sexes. Urinary infections are more common in women, whereas stones, tumors, cancers, all these are more common in men. But both sexes are affected by various urological diseases. What we normally see in the outpatient practice, the commonest disease will be stones in the urinary tract, either stones in the kidney or in the ureter or in the bladder, both in men and women. Then we see prostate diseases, prostate enlargements, which is very common in the aging population, prostate cancer. We also see urinary tract infections. We also see tumors of the kidney and bladder and other things. And in younger age groups, we see birth defects. Children are born with abnormal urinary systems. So all these need to be treated in our field. Andrology is a disease of sexual health in men. Okay, it's very common nowadays in this because of the present lifestyle. The kind of stress people undergo in, say, private banks, insurance companies, any sales and marketing, they are under so much stress that they have all these kind of problems of sexual dysfunction. So we have a specialist in our department who treats such people. Then we have a section called infertility, where couples cannot have children. So there also andrologists help to evaluate why this happens, and we have the facilities to treat these people so that they have children. So these are also part of urology, but it's a very specialized part. Most often patients present to us with intense pain. Now that's because stone is the commonest symptom. In fact, the pain is so intense you can almost, it is one of the most severe forms of pain when you have a stone in the urinary tract. You can equate it to delivering a baby in severity of pain, labor pain, like labor pain. So stones present with pain, whereas tumors can just present with a dull, some mild fullness or some pain in the abdomen. Then the second symptom we get is blood in the urine. Now at any age group, if somebody complains of blood in the urine, it cannot be ignored. We find many practitioners, both allopathic as well as Ayurvedic and homeopathic, when somebody comes with blood in the urine, they'll just give some antibiotic and tell them to drink water and go away. But blood in the urine is such an important symptom, they have to see a urologist, and at least an ultrasound scan of the urinary tract should be done to rule out cancer or stone. So pain, blood in the urine, and urinary tract infections can present with difficulty in urination, burning sensation while urinating, frequent urination, waking up many times at night to urinate. And prostate enlargement can present with obstruction. It takes a long time to pass urine, it goes very slowly. Sometimes it gets blocked completely and a tube has to be inserted to relieve the obstruction. So these are the common ways in which patients present to us. Stones are depending on the geography. It varies from place to place. Like Kerala has got a high incidence of stones. Middle East has a high incidence of stones. North India like Madhya Pradesh, Rajasthan, Gujarat, you get stones. But probably the difference is in the dietary habits and the climatic conditions, very hot climates, people who eat a lot of meat, and where the water is in short supply. That's where you get stones more commonly. Why you get cancers is, once again, smoking is a common cause for most of the cancers in the urinary tract, and then exposure to chemicals like in factories where a lot of dyes, paint, batteries, all these things are used, you can get bladder cancers. Basically, if you see the urinary organs, the kidneys, the ureters, bladder, all of them are very deeply located in the body. Being very important organs, God has sort of protected them well. They are surrounded with bones like a shield. Like both kidneys are protected by the ribs and by the spine, vertebra, so that even if you have an accident, your kidney doesn't get damaged. So God has protected these organs very well. The bladder is right surrounded by the pelvic bones. Prostate also is all surrounded like that. So if in olden days or even today in some places, if you want to operate on this organ, which is so deep inside and protected by so many structures, you have to make a huge cut. You literally have to cut the body like this, open, and go right inside and take out and do whatever you want. So what used to happen is it's very painful for the patient. They take a very long time to recover, to go back to work, and all these big cuts can get infected. Stitches can give way, and there can be a lot of problems. So very often patients will be out of action for 3 months after any urology procedure. So now whatever could be done by open surgery with newer technology and expertise, it can be done through keyhole means. That is, we put small holes and introduce a camera to see the organ, and then we introduce other instruments through other small holes, and we do the same surgery through small holes rather than this big cut. So this is what is meant by laparoscopy, and it has maximum benefit in urology because patients are admitted for a day or two, they get back to work in 1 week. There's no cosmetic problems. The ladies can wear a swimsuit and run on the beach. You won't know that they've had surgery. Otherwise, there'll be one big ugly scar, So that is the advantage of laparoscopy. You can treat kidney tumors, kidney stones. You can repair defects of the kidney which have by birth. You can remove stones in the ureter. You can remove the bladder in cases of bladder cancer. You can remove the prostate in prostate cancer. And literally anything which used to be done previously by open surgery can now be done by laparoscopy. And it has an additional advantage for the surgeon also, because this all involves high-tech cameras and high-definition cameras, three-dimensional cameras, all these are there. So you may even have better vision through laparoscope than by actually doing open surgery. Everything is on a big screen, magnified. Everybody around is involved in the operation. Everybody can see what is happening in the operating theatre. See, now in large masses, you have to find out if it's malignant or not malignant. Suppose you have a big kidney is enlarged because it is blocked from birth. Then like a balloon it will enlarge and sometimes become 5 liters capacity. Something like this, once you deflate it, it will like a balloon, it will collapse and you can literally take it out through a small hole, pull it out. Tumors, you can't do that. In olden days they used to, like a small mixie used to be inserted into the abdomen and like you will mixie grind this tumor and take it out, suck it out. But then they found that this tumor cells were spreading and it has been given up for all cancer cases now. So for cancer cases, you have to make a small cut to extract the tumor. The cut will usually be as big as the size of the tumor. But unlike in olden days where we had to cut in the upper abdomen, like kidney is here, you have to make a big cut here, even remove one rib in the process. It's painful, it's not cosmetic, and when you breathe, every time you breathe, that upper part of your abdomen will hurt so much, So now we'll do the operation and remove the tumor from below we call it the panty line. Okay, you can make a cut like cesarean section, how they make a cut in the lower abdomen. You can make a nice clean cut and take out the organ from there. It's less painful, more cosmetic, scars won't be seen, bones, ribs don't have to be removed for it. We have a system here called outpatient urology clinic, outpatient or day case urology practice. Now suppose a patient comes to me with a kidney stone. I see him in the OP, I take him to the next room where I will do my own ultrasound. I can do an ultrasound by myself and I have a machine here in the OP itself which can painlessly break the stone by delivering shock waves, not electric shocks, sound waves. And after a couple of hours, this patient who has walked in can walk out without his stone. So that is the beauty. You don't have to get admitted and spend 2-3 days in the hospital and go through a painful process, leave your work. Bystander has to come and stay with you. He also has to take leave. So we have a system where we can treat most of the things as a day case. You come in the morning, go out in the afternoon, go back to work tomorrow. Your stone is done, stone is treated. So we have an ESWL machine, it's called ESWL, extracorporeal shock wave lithotripsy, that's the expansion, for painless and easy treatment of stones. Then we have investigative facilities like ultrasound in the outpatient and something called urodynamics. Urodynamics is to study the function of the urinary bladder. There are some people with neurological diseases and some women who cannot control urine. When they want to urinate, immediately they will urinate like small babies and their clothes will get wet in public, they are embarrassed. So that's because there are some problems with their bladder. So we have an equipment here to make a diagnosis why it's happening like that. That's called urodynamics. Well, depends on what kind of disease. Once again, if it is stone disease, you have to modify your lifestyle. One is water intake. You find people, especially in Middle East, where they work in air-conditioned environment, they don't drink sufficient water. So you have to ensure that the patient drinks sufficient water to maintain a colorless urine. It should not be yellow in color. Second thing is they have to modify their diet. They have to reduce the red meat, they have to reduce the Pepsi, Coke, coffee and tea. They have to reduce salty items like mixture, chips, pista, badam, kapalandi, cashew nut. All this has to be reduced, salty items. And that's about it for stones. Now cancers, first thing that has to stop is smoking, because suppose the bladder has been affected by cancer, we remove the bladder. But if the patient doesn't stop smoking, then he'll get cancer in the kidney. Then you go and remove the kidney. So if you want to reduce his further risk of developing cancers, you have to stop smoking. Then for urinary tract infections, we suggest that they take fluids once again adequate and maintain good hygiene of the genital tract. Then these are basically the lifestyle modifications that we need to do. Hi, I am Dr. Sanjay Bhatt. You are watching me on webindia123.com.